Marg Rogers and I'm a doctor in early childhood education at UNE in Armidale, New South Wales. I'm also part of the Manna Institute, which is a mental health research institute as part of the regional university network, which is throughout Australia. The research that I'm doing in paediatric mental health is forming a team that helps to create early intervention psychosocial resources for children from veterans and defence families and also first responders. ADF members live in rural, regional and remote communities throughout their career. At any one given time, 30% of members that are current are in these regional, rural and remote areas, and that has severe impacts for their mental health as well, because often the families that travel with them and live in these communities have trouble accessing the types of mental health services that they require. And they often move in and out of these areas, meaning that they often go on waiting lists for services, and when they finally get to see somebody, the practitioners may or may not have the skills that are required for a very specialised set of stresses that these families endure. With veterans, we know that 50% of Australian veterans live in these RRR communities, and their families often live with them, and therefore the impact of that is that the very specialised services they need are often in metropolitan areas, so the whole family often has to accompany the veteran to seek these specialised treatments. Additionally, we know that first responder families live within RRR communities because that's often where bushfires are, or they're needed for paramedics or police and other first responder services. So what needs to be understood is that children are in families where there are high levels of trauma, and that is often not seen, and that children will respond to those traumas, and they're often exposed to them either from things that they've heard through the media or things that they've heard their parent tell them about their work, or just the general functioning of the family. The parent often has high levels of trauma, which comes out in various behaviours like risk-taking, also high levels of drug and alcohol use in order to cope, and these all impact the safety and the security and the well-being of children. Not much is known about the effects in the Australian population exactly, but US studies show us that children of veterans are 3 to 4 times more likely to suicide in their lifetime, and that they have more likely to experience severe mental health problems. The Royal Commission into Defence and Veteran Suicide has pointed out that there are a number of challenges for children in these families. Firstly, that they're often invisible, and they are the invisible victims of war. And secondly, that they are subjected to secondary transference of mental health issues that family members have from their service. Some of the key findings of the research have been how undervalued and under-resourced families have been in the amount of support that they supply their children, and also the veteran or the first responder or the defence member. And this has been under-recognised with the amount of caring that they do. So the research has shown that these children and that these parents who are non-service members need more psychosocial supports, and they need supports that travel with them and can be used from wherever they are in the world, because they're often moved around in Australia, but they're also moved around overseas as well on their postings, and that they need online resources because these resources can travel with them. Another thing that's come out is the fact that they have a very fragmented healthcare access, and this can include mental health resources and mental health supports, but also access to physical health resources. And so we really need to be thinking about setting up care that wraps around the family and moves with them wherever they are, which could be telehealth or video health resources. We've created research-based resources, including storybooks using children's narratives, and also modules to upskill parents, educators, support workers and clinicians. And they are available online. The idea of the storybook is to use children's narratives who have grown up in these families in order to support their understanding and their ability to cope with a parent with moral injury. Our work has been adopted and culturally translated by Canada, and they have culturally adapted our resources for their families. Also, we've been working with the King's College in the UK, who have a centre for military health research. They have been working with us to co-create resources for their families, specifically ones who are impacted by moral injury and other service-related health conditions. And we are also moving forward in that space and co-creating new resources together with the Canadians and with the UK partnerships.